So this is a fantastic question, and I don't think I've been asked this on social media before. So say you've had breast implant surgery and you need a revision. Something's not right about your result. The implant's too high, too low, too far to the side, too something, and you're going back to the OR. Do you have to replace the implant? Now, I know it's really tempting to always keep the same implant because it saves you a couple $1,000s, but let's talk about situations where you can keep the implant and when you probably shouldn't. Okay, so first of all, it's important to note that it is off-label to use the same implant. So off-label means that during the FDA trials where they studied implants to approve them for use on the US market, they didn't study them in this way. So when you use them this way, they are technically off-label. That doesn't mean it's wrong, it just means it wasn't involved in the original FDA trials. So first let's talk about a couple situations where I don't think you should use the same implant. So first of all, it would be an implant infection. So an implant infection is treated in two ways. You either remove the implant and let the area heal, or you can attempt implant salvage. So if you're going to attempt implant salvage, you really need to use a fresh implant because since it's a foreign body, it's really hard to get rid of bacteria on the implant no matter how you clean it. So in that situation, I think you should always use a fresh implant. I also feel the same way about exposure. So say you have healing difficulties and your incision opens up and your implant is saying hello to the outside world. It's probably got bacteria on it. I don't think that's a safe situation if you're going to try to salvage that implant to use the same one. So I would clean everything out and use a fresh implant. And then the last situation where I wouldn't recommend using the same implant is capsular contracture. So when you're treating a capsular contracture, you have to be cognizant of the fact that many of these develop from biofilm or a low-grade subclinical infection. So like I said, whenever there's an infection or worry about infection, I always use a new implant because it's difficult/impossible to clean an implant well enough to get rid of bacteria on it. Now let's talk about situations where you can use the same implant. So say you've had surgery and everything looks great, but the implant is just sitting a little higher than it should. You don't have a contracture, things just never settled. So I think that's a reasonable situation to go in, drop the implant, and keep the same implant. Same thing if the implant drops a little lower than you want or a little further to the side. So in those situations, it's not really a problem with implant infection. There hasn't been an exposure. You just didn't form capsule or your crease didn't hold, and we can go do some work internally to get the implant in a better position, and I don't think that always needs a new implant. And then of course, if you are doing any type of revisions that don't mean you're entering the implant cavity. So if it's just a scar revision, little tweaks maybe to a mastopexy where you're leaving the implant in the right position, I don't think you obviously need to change the implant out, especially when it's never seeing the outside world. It is just hiding in its capsule, happy, while you're doing some little superficial revisions. Now, in those situations where I would use the implant, the same implant, those are situations where the revisions happen within a short time period after the original surgery. If the implant needs to be revised or there's some issue with the implant further out, even if there's been no exposure or infection, I always recommend getting a new fresh implant because you have to remember that implants weaken with time and they start to have higher risk of rupture. And if it's already an older implant, I think this is the perfect time to go in and swap it out to a newer implant and reduce your risk of rupture-related complications. So for example, if your implant just never dropped, it's within the first year after your surgery, completely reasonable to keep the same implant. So say another patient is 5 years out from surgery, their implant has dropped too low. In that situation, I would recommend switching out to a brand new implant. So it's important if you are this patient and you are having a revision and you're interested in keeping your implant that you talk it out with your surgeon. You'll probably hear different ideas about when this should and shouldn't be done from different plastic surgeons. And it's always important if you're doing something off-label that you discuss that with your surgeon and come up with the best plan for you.